A lot of the complaints about people with that diagnosis are that they can be explosively angry, and they also can be very, very needy and demanding of therapists or other people. And they also then have scary symptoms, like they get suicidal, or they can have panic attacks, or they can, like I said, be enraged at the drop of a hat. And so they get a really bad name in the psychotherapy world. And because I worked with that population for 20 years probably, and as I started to get to know their parts and saw what happened, virtually all of them had been severely abused, most of them sexually abused as children. And so they had all these exiles, and they didn't know what the hell to do with the exiles. And so they had a protector whose job it was to recruit some other person to take care of those exiles, because they didn't know what to do with them. And that recruiting protector was really, really talented often at sucking somebody in, like a therapist, to sort of be their parent. But as soon as that therapist got close enough to do any damage to the exile, there was this sort of bouncer rage part that would jump in out of the blue, make a therapist's head spin. But if you understood it the way I just described it, it was totally predictable, because you got close enough to do damage. And so then the rage comes in and pushes the person away, and then the recruiting part comes back to try and pull them back in. And throughout all this, especially if the therapist gets triggered and starts to distance, then these other scary firefighter activities start to kick in, like suicide or substance abuse. And that then scares the therapist even more, who gets even more protective, and you're in this vicious cycle. And so many people with that diagnosis wind up deteriorating from therapy because the therapist got scared, and the fear is mainly because the diagnosis is so scary. But if you thought of it all this way, then when the rage comes, you don't get triggered. You just expect it. You know, it's not personal. It's like the mafia. It's business. It's not personal. Whoever was in my chair would be getting nailed by that part just for getting close. So you hold this perspective that allows you to stay, for you to stay calm and what I call in self, even in the face of a lot of these scary things happening.